Hello there, my name is Stephen Reams. I am the Executive Director of Ada County Medical Society. We are a physician-focused member association, which represents not only doctors, but also PAs, NPs, medical residents, and medical students here in Ada and Elmore counties. We've been around since 1959, and we are naturally the largest medical society in the state of Idaho at the county level, and we're conjoined with the Idaho Medical Association in terms of membership. Now, we're kind of like a chamber of commerce, I like to say, for doctors. We basically provide medical education, member services, networking, and social opportunities for our members. And one of the things that we've been focusing on since about 2015 is physician well-being. We've recognized that there's been a steep increase in terms of physician distress, based on in large part, the great number of responsibilities that have been pushed their ways, the increasing complexity of electronic health records, as well as just a difference in consumer expectations, the way that they're being paid, the way they're being employed, and other factors like that. And so in 2016, after hunting around for a while, looking at some solutions, we stumbled across a program at the Eugene, Oregon, Lane County Medical Society, and they had started a program, the first in the nation to do so as a county society, a program that would serve their members kind of like an EAP does, except that it wouldn't be tied to employer. It would be tied as a membership benefit, or as in their case, the foundation providing that as charitable access for physicians. And basically what they did is set up an EAP and contracted with a therapist in office and provided those counseling appointments anonymously to physician members. We found that program design, we adapted it and began to work on that and finished putting that together in 2016. And since then, really proud, in 5 years, we've provided more than 1,000 appointments to over 200 of our members over the past several years. And all of that is cost-free for our members, just as a member benefit. During the past couple of years during COVID, we had a temporary expansion policy in place. And this year, we're just about ready this summer to add on the Idaho Academy of Family Physicians, who will also be accessing our program statewide. And because of telehealth and moving towards that in the middle of COVID, we are able to provide this service wherever our clinicians reside. We use licensed clinical social workers and counselors and psychologists to provide these services. We do not use psychiatrists because we want to keep our members' health records out of an electronic health record and out of psychiatry so that it doesn't land there. And I'll talk about that a little bit more. So what I want to do is go through the kind of guts of the program and how it operates and how you as a therapist would interact with us, so that when we get to meeting with you, if you're interested, we won't have to cover these details as much, but can just focus on the questions that you might have. So I'm going to share with you my screen and some of the documents that we use routinely with our clinicians. This is our kind of 1-page, 2-page how-to. And the first thing that you need to understand is that members are responsible for finding you. We don't do much brokering unless somebody calls me and says, I'm looking for a specific type of counselor, or I can't seem to get an appointment or something like that. So when a member calls to make an appointment, they're going to do that based on going to our website. And our website lists the all of our counselors. So our website describes our programs. We have a brochure for that. It talks about confidentiality as the most important thing. We, ACMS, never sees the name of people who come to you. And we also guarantee that their employer and the Board of Medicine can't get access to that. We have a consent to treat form, and we screen all of our therapists and try to make it as convenient as possible. So they'll go to the list of therapists here on our website. They will find a profile of the different therapists that we have available, kind of what hours you're available, how to make an appointment directly with you. Presumably you're going to have telehealth available, and just kind of some more details. I would love to be able to put videos of all of our therapists on, but that takes a little bit of work. And I think it'll be better though in terms of helping physicians kind of get a sense of your character, demeanor, and if they're a good fit. And as you see, we have people not only in Boise, but also some out-of-state providers that are licensed in Idaho, as well as other parts of the state. And we're trying to grow our in-state network outside of the Boise area. So once they call you, they can make an appointment with you. And at that time, they can either download the consent to treat form, or they can go ahead and find that on our website. In fact, if they, you can point them here, or you can give it to them directly. We have all of our forms here, and the consent to treat is something that is an electronic version. They can sign it and give it back to you. And it basically says, you know, all the ways that we operate: confidentiality, how many appointments they get per year, what the services are provided, eligibility, so forth and so on. And that's something that you would keep on hand for yourself. So also on this website, we have an informed consent script, which basically helps you walk through with them the consent to treat form. Typically, you don't need a script. I know you're professionals, but just in case there's any questions about how we cover that material or prefer to be covered, it is there for you to be able to use. Then we get to the demographic appointment record card. Once you verify them, well, let's actually go over verification. And so we have a place right here, the qualified members directory. And so let's say you have a Dr. Johnson come, you would come here first before you make an appointment with them and search for them in our PVP directory access and find out that they are in fact qualified as a current member. And so what you're going to come up with is a list of all of the Dr. Johnsons, and all you have to do is go, okay, great. Dr. Johnson is currently a member of ACMS. Now, I said also that we are adding this Idaho Academy of Family Physicians on this year. And so we'll be sending just a manual list on a monthly basis to you to check again, since they don't have this type of search directory set up for their physicians. So once you have verified with them, you can have their first appointment. You can go over the consent to treat, and then we have you keep record of that on this appointment record card. And what this allows you to do is simply document your benefit eligibility under us or under IAFP, what date you verified them, and some of the demographics that we keep that you will report would be the urgency of the appointment, whether it was telehealth, no-shows, or if it was a meet and greet, age, gender, county practicing in, if it's outside of Ada County. And then always checking to make sure that if they've used another counselor from our contracted list in the previous 12 months, that's part of their 5. So it's not 5 for this counselor and 5 for this counselor. Hopefully there's no double dipping going on. We never know, but you know, if people really need it that bad, then they really need it that bad. And then what type of member they are and their specialty, as well as their employment status. So you see, this is where you keep all of this information. You keep this form as your record of the different things that you have taken down from them. And then when it comes time for billing, this is really simple. You're going to love this. Way easier than any insurance thing that you've ever used. You'd come over to our website. You would say, I'm going to bill for the previous month's appointments. You're going to affirm which eligibility you use, ACMS or IAFP. ACMS, was this a first-time appointment? Yes. Did you within the last month have a second appointment? Let's say you had first and second appointment. That's going to be 2 appointments. We pay $125 per contracted hour in 2022. And then how many of them were no-shows? None. No meet and greets. Total invoice, $250. Telehealth. 1 was kept by telehealth because you met them in person for the first time. Let's see, maybe the first appointment was urgent, but the second one was normal. And then member type. This was a physician, age 47, gender male, specialty. He was oncologist. Employment, he was an independent large practice. Primary initial challenge was anxiety, had never used the program before, and he was in Ada County. If you have a billing record that you want to tie it to in your own system, you can put that there. Otherwise, go ahead and put down your counselor name, anything else we should know about your billing, but we do not want names. And then submitted by Tess and my Da-da-da. Submit. Boom and boom, and it's done. You're going to get a copy of that email. I'm going to get a copy of that email, and I'll pay you typically within 2 weeks. So that's the billing. No names, very straightforward. And if you ever have trouble with the billing, then you can talk to me. Some of the other requirements that we have would be that we would need access to your insurance certificate. So I need a copy of your current state licenses, your professional insurance. We have a contract for you to sign that describes the program, a W-9 for tax purposes, and then all the things that we would put on the website, a photo and information like that. And we actually have a form that you can find or that you can submit all of these forms, either the first time or thereafter. And let me get this form up. All right, so our form, here's your application form. If you're a first-time contract counselor or you just have changes to make since last year, then there's all these places that you can fill this detailed information out, practice details, and this is all the stuff. Instead of putting it on paper, just put it straight here and we can put it right into our Excel spreadsheet. And those types of things. You can upload your current occupational license, your current certifications and insurance forms, different things like that. So all of the stuff that we need to make this operate. So one thing that we have learned over the years with this program is just the very, very big importance of confidentiality. Some of our doctors might be nervous about coming into a clinic where there's a waiting room where there might be other clients waiting. So it may be that you have a back or side entrance, or when you're actually done with your client, they can wait to leave, and then you can text the physician and say that you can come in now. There's nobody in the waiting room. Whatever we can do to accommodate confidentiality for physicians. Of course, telehealth helps us out extensively, but again, maybe not the best way to establish a client. Although anymore, I feel like yeah, we're over that barrel and it's not a big deal. But I also understand that for a lot of therapists, they may not feel it's the most effective way for interaction. So we'll leave that between you and our members to decide how to work that out. And then in terms of records, we ask that just that limited demographic card record be kept. If you need to keep any kind of progress notes, limited on paper. If you do keep anything in an electronic record, whether appointment names or if you have a HIPAA certified electronic system, especially if you're on telehealth, sometimes these are built in together, then you just have to disclose that so that the physician or other members know exactly how electronic records are kept. They're really nervous about insurance records, electronic records, and anything we can do to lower the barrier so that they will get in to get their mental health worked on, optimizing their performance. That's just crucial for them. And what we've just seen some tremendous outcomes from this program. People who said, you've saved my marriage, I was about to quit practice, you really helped me over my depression. Recently we had this flap at one of our big hospitals at St. Luke's over the removal of a child in a child welfare case. I'm sure you know the public story about that. And we definitely saw, just by demographics, we saw a big spike in utilization for that month from hospital providers who are pediatricians. And so we know that this is being used both reactively to situations that pop up, as well as people who just want to proactively work on things in their life. And here's what I think you'll find is that physicians are extremely motivated to get in, work on stuff, and get out. They do their homework. They aren't just to do talk there. They're not there just to do talk therapy. They really want to get in and solve a problem, and they're delightful to work with. That's what all of our counselors have noted. So that pretty much describes our entire program. The only other thing I might mention is that we have a form. We don't require use of this, but it's nice when we get them. We have a member satisfaction survey. If you're able to provide that to somebody who is finishing with you, or after 5 appointments in a 12-month period, that would be great. We don't get many of these back, but the more we get back, the more we can utilize some of those stories. Sometimes I get emails directly, and doctors are just over that confidentiality thing. They're saying, I don't care, you can use my story, I want other people to use this too. I will mention one more thing, and that is just the limits on the way the contract work is that people can have, for ACMS members, 5 appointments in a 12-month period based on the first date that they start. So let's say they start their appointment on May 26th, 2021. They would have until May 25th, 2021 to use 5 appointments. If they use them quickly or if they use them over the course of the year, it doesn't really matter to me, but it wouldn't be until May 26th, 2022 that they would be eligible for another batch of 5 appointments. Let's say they wait though until January 10th, 2023, then January 10th becomes their new 12-month period until January 9th, 2024. So it's whatever 12-month period, starting with that first appointment, going out either 12 months or 5 appointments, and then waiting until that 12 months is up or later to start another 12-month period. So not quite on a calendar year or benefit year. The benefit year begins with the first utilization. And this is renewable each 12-month period thereafter. So as long as they're a member, they can have that 5 appointments per calendar or per 12-month period year. I'm sure other questions will come up, but we'll cover those when I meet with those of you who are interested. At the end of this video, I'm going to point you to just kind of a summary overview video of the different initiatives that we have besides our therapy access, and what we're doing to try to actually make change so that it's not just an individual effort by physicians to make themselves better. It is really about organizational, institutional, and cultural commitments to physicians that create change so that doctors just aren't so distressed to begin with. So thanks for your interest. I'm sure you have questions. Feel free to reach out to me, 208-336-2930, or director@adamedicalsociety.org. Looking forward to meeting you. Thanks.